Let's do it again.
Okay, my son Nick is 4 years old, bright little boy. He is also hearing impaired with autistic tendencies.
Linda noticed that Nick's milestones were delayed and put him in Early On, a program through the school district for infants and toddlers with developmental delays or disabilities.
So they were very cautious with the way they worded things, and then I went on my own to begin the process with the behavior therapy.
Well, what we have going on here is ABA therapy, and what that is teaching the most basic skills and breaking them down to small steps to allow an autistic child to gain knowledge in those skills through repetition and lots of reinforcement. Everything from the areas of social skills, communication skills, learning to listen and follow directions, learning to express themselves, everything from teaching a child who doesn't have any verbal skills to point, and those who do have verbal skills to expand what they're saying.
Applied behavior analysis is widely recognized as a safe and effective treatment for autism. ABA is a scientifically validated approach to understanding behavior and how it is affected by the environment. And in this context, behavior refers to actions and skills. Environment includes any influence, physical or social, that might change or be changed by one's behavior.
Well, first I want to say that I'm very grateful to be with this program because they are all wonderful here. Second of all, hurdles, there was a few. I skipped over to the doctor. My pediatrician said, "No, Nick, there's nothing wrong with him. He's just hearing impaired." But as a mother, I knew that there was something more going on. So I contacted my insurance company, and then they linked me to a psychologist who evaluated Nick. And then from there, we just went through the process of getting linked to MORC.
What happens when autism is suspected?
We typically get a referral, depending on where the referral is coming from the county, or we have the pediatrician will first do an MCHAT. It's a screening tool to see if they have some of the characteristics of. And if they do, then there are always diagnostic evaluations that come next. I give them the autism diagnosis. Once we get them, we do an assessment. And we use a tool that helps us determine what specifically they need to work on. You know, it'll tell us right off this child can't point, so that's something we should work on. Or if they have language skills, they're unable to fill in the blank if you say a sentence, those sorts of things. Once we determine what to work on, we give them up to anywhere from 10 to 20 objectives or skill sets that we're working on. They're given a technician assigned to them, so they have one technician. At a time, it's one-to-one work, and the parent is given a copy of what we're working on and told daily what we're working on and what they can work on at home when they come and pick up their child. We tend to see progress within months. We are constantly changing those objectives because they'll meet, oh boy, they can point, now let's try, the first word, and so we are constantly changing those and watching them grow in all the different little areas.
The Macomb-Oakland Regional Center, or MORC, is known as a center of excellence utilizing only evidence-based therapies in providing supports and services for people in Southeast Michigan with developmental disabilities, including those treated at the MORC Autism Center. Michigan is also one of 34 states who mandates that health insurance cover autism intervention services, which can be very expensive.
ABA therapy is very expensive, so I'm very grateful that we were able to be a part of this wonderful program for Nick.
Well, ABA has been found to be evidence-based as being very successful for children. There are some children that even are able to be mainstreamed into regular classrooms after ABA therapy. Again, it's taking skill levels or skill sets such as communication and educational sets and social skills and breaking them down to small steps.
Usually when a new kid comes through, we kind of probe for their skill level in a variety of different areas. Verbal behavior being one of them. So we kind of gauge their skill level on a few different things, verbal behavior as well as kind of the life skills and preparing them for like school, preschool, kindergarten, and so forth.
I develop treatment plans and do assessments here with the children and when they come in when we get a referral. So we sit down and we use the assessment tool called the VB map, and it tests like verbal behavior, independent play, echoics, and like repeating, tacting, and manding. So those are just like the jargon for the behavioral side. But it just comes down to like their functioning levels, and then we place them with lessons here in the center to help acquire better skills in those areas.
We ask that parents participate as often as possible, minimally 1 hour per week. Some parents are able to spend a whole day with the child. Some parents, because of their work schedule, just try to chop out 15 minutes here, 15 minutes there. We'll take whatever they can do. And we always have the technician review every day with them what they've worked on, what they can work on at home, and they see a lot of the successes at home as well.
I think ABA kind of combines everything. I mean, it has a little bit of OT, it has a little bit of the speech part, it has a little bit of the play and independent play, so it kind of encompasses everything together.
MORC is a great place to work, both for the technician and as a child coming here. It's very relaxed atmosphere, very gentle atmosphere to work in and be a kid in. It's a very laid-back environment, and it's conducive to learning.
Yeah, I think it's also goes into a play like their communication is lacking, so they can't tell you if they're hurt or they don't want to do that, or if they want to go this way instead of that way. So what helps is when we try to implement like picture cards, or some of them will sign in hopes that that will lessen the tantruming or the meltdowns, because then they'll have a way of communicating their wants and their needs.
So tell me, what sorts of improvements have you seen in Nick's development?
Huge improvements with Nick. Nick's sitting more. He's pointing. He's giving me more eye contact. I noticed his speech. He's trying to talk, and with him being hearing impaired, too, that's huge for us. He just seems like a happier little boy overall, and we're very grateful for that.